Hello, I'm Dr. Marla Shapiro. I'm a professor in the Department of Family and Community Medicine at the University of Toronto, and I sit on the Board of Trustees of the North American Menopause Society. I'm joined today by Dr. Cheryl Kingsberg, a well-known face for us, Chief of Behavioral Medicine at MacDonald Women's Hospital and Professor in Reproductive Biology and Psychiatry. So the topic of sexual health. Many physicians don't include it in their functional inquiry or their exam, and in fact, many feel that it doesn't make the list of their top 10 concerns. So,
well, one of the reasons they don't think it's in their top 10 concerns is because it's not life-threatening. However, most women, just like most men, would consider sexual health critical to their quality of life. So even though it may not be life or death, it is critical to their quality of life, and they will perceive their office visit much better. They have much better doctor-patient satisfaction, more likely to adhere to what your treatment options are if you've asked about sexual health.
So I think the bias from physicians is that if this is an issue for a woman, she would bring it up. If she's not bringing it up, how do I even begin to take the history, and how long is this going to take?
Sure. Well, I'll give you some good news. It doesn't take long. But the truth is that women are uncomfortable bringing it up. They don't know, A, that sexual dysfunctions are real conditions. A lot of healthcare professionals don't recognize them as real, but they are. And they don't know that it's appropriate to ask for help, particularly from their doctor or their nurse practitioner. So that's why they're not bringing it up. They are absolutely desperate for you to ask. And to ask is not going to set you back by 45 minutes. It will take 2 to 3 minutes, and you can do it very easily. First of all, you can use a screener in the waiting room if that's what you want. If you're looking at, for example, low sexual desire, the most common sexual problem, there's the decreased sexual desire screener, which is 5 questions that gets at A, a diagnosis, and B, whether you can rule out all the other factors that might be the real cause of a low desire, like a medical condition, a relationship factor, or super stress in somebody's life. You can have it already done and scored in the waiting room. Other than that, simply asking open-ended questions. I know everybody kind of shrinks from that, but what sexual concerns do you have? And then you can follow up with, do you have concerns with desire, arousal, orgasm, or pain, which will get you all the key categories, and then you can make some decisions about treatment options from there. You don't have to do the treatment. Just asking, normalizing it for women, validating their right to a sexual health already makes them feel satisfied with your office visit.
How many women are we missing by not doing this history?
Probably about 10% of your population. We know from large epidemiologic studies that about 1 in 10 women meet the criteria for a sexual dysfunction. So if you think, oh, no women in my practice are having sexual concerns, you're not asking.
Seems like a pretty simple approach to a problem that is so prevalent.
I promise it is simple. It will not take up the whole part of your day, and your patients will feel very satisfied and very relieved that you've asked.
Thank you so much.
Thank you.